Good morning. Uh, Good morning, wherever you're watching us from. My name is Mr. Selfcare, and I welcome you to yet another beautiful episode this Sunday, where we are going to talk about a new topic, a new episode, and that is understanding and overcoming infertility in women. The problem of infertility in women is one of those big, challenging health problems when it regards to reproductive health. And many families are undergoing or are going through silent battles and fights because of the issue of infertility. Having a child or having children in homes or in families, especially in Africa, is a very big issue. And those families that normally fail to have children, especially when everyone expects them to, normally face criticism from both within families and those close to them. Last week, we started this topic where we looked at infertility in men, and we looked at different factors that could be responsible for this type of infertility. We had a guest, Dr. Paul Chibenge, who properly explained the causes of infertility in men, the signs or the symptoms, the proper definitions when it comes to infertility, and what men need to do if they think they could be having that problem of infertility. Today, we want to flip the coin and look at the other side of infertility in women. First of all, let us understand what infertility looks like or what infertility means in women. When it comes to women, the definition of infertility is not different from what we saw last week. Infertility means a process or a condition or a health challenge where a woman is married and keeps having sexual intercourse with the husband, or they have intercourse with the husband on a regular basis. They stay together for 12 months, but then she cannot conceive. So there are two things here that we need to pay attention to. Number one, that woman must be ready to conceive, because we are not talking about people that are not ready to conceive or people that are on contraceptives. That woman must be ready to conceive. She must have someone that she sleeps with, or someone to have sexual intercourse with, and on a regular basis. And according to WHO, these people should have been together for at least 12 months. Last week, Dr. Paul explained that there is what we call delayed conception and then infertility. With delayed conception, most of the time the period is below 12 months. Like you have a boyfriend or girlfriend, this person normally comes around and goes away, but then you're not conceiving. Delayed conception could be due to so many factors. Sometimes the lady is not conceiving, maybe because each time she sleeps with the husband, she's not in the rightful days to conceive. Sometimes she's in her safe days, or sometimes the lady sleeps with the man when maybe the eggs or the ovum are not ripe or are not ready to be fertilized by the man's sperm. This normally happens with ladies who have men that come once in a while or just come periodically. It is very possible that you have sex with this man for 6 months, but all the time you're having sex with her, he or she's having sex with you in when maybe you're in your safe days or in a period where you cannot conceive. So when we are talking about fertility, we are talking about a lady that is ready to conceive and regularly sleeps or gets intercourse with a man on a regular basis, and they have been together for at least 1 year without using any contraceptives. So the problem of infertility in women is a big one. And if you look at all couples that cannot conceive, or if you look at all couples that are struggling or are not having children, infertility in women is responsible for about 35% of all couples that are failing to have children. And the other 35, the men are responsible, so that is 70%. The 15%, both the man and woman are responsible, and the other 15%, both the man and the woman have no problem, but for some reason they cannot conceive. God knows why that small percentage is there. So it is really important that each time there is infertility in a couple, couples have failed to conceive or to have a child of their own, both the man and the woman go to the fertility clinics to look for a genuine cause, or to try to look for what could be responsible, because sometimes it could be the man, sometimes it could be the woman. And the last 14 days, we've tried to explain everything to do with the men or the male side. So today, the next 14 days, we are going to be looking at how women could be the cause of these infertilities. Number one, I'm going to be responding to the questions that so many people have been asking me throughout the week when I posted this topic of infertility in women. Number one, the biggest question was, what are the causes of infertility in women? Now, the causes of infertility in women can result from a wide range of factors, as we are going to discuss. Number one, there could be biological factors, there could be hormonal factors, there could be lifestyle. There are lifestyles or healthcare diseases that affect the process of ovulation, fertilization, or implantation. Now, when we are talking about infertility in women, anything that affects the process of ovulation, a woman not being able to ovulate, because we know ovulation is that process when a mature egg is released by the ovum to start moving into the fallopian tube, where eventually fertilization takes place. So anything that affects that process will normally somehow cause infertility in women. Number two, the process of fertilization. For example, this fertilization is supposed to take place in the fallopian tubes or the oviduct. But if for some reason that process cannot take place, say maybe if there are infections in the fallopian tubes, say the tubes are filled with fluid which we call hydrosalpinx, they are filled with pus which is pyosalpinx, or they are inflamed which is called hydrosalpingitis, or if there is there is anything that affects those tubes, then the process of fertilization is going to be affected, and also that can also lead to infertility in that woman. So let us start with the biological causes. Number one, ovulation disorders. There are so many reasons, or there are so many factors that can affect ovulation in a lady. Sometimes the hormone imbalance, and these hormone imbalances can be caused by a number of factors, like contraceptive pills, some foods, some medication, anything that affects your hormone levels sometimes will lead to will affect the reproductive hormones, and then that will eventually lead or affect your ovulation period or ovulation process. And if this process is affected, then you're going to have issues when it comes to fertility, because as long as the egg is not released in time, then you may end up having ovulation issues and eventually leading to infertility. Number two, the other cause of infertility that is biological, we call it the polycystic ovarian syndrome, or so many people call it PCOS. Now, this is a condition where a woman develops very small cysts around the ovary. You develop very small cysts around the ovary. Now, these small cysts prevent, number one, they affect your hormone levels as a lady. Number two, they even prevent sometimes the eggs from reaching their maturity. And this is responsible for a number of infertility cases in women. Normally, this problem is detected when you go for a scan, and they do, most especially transvaginal scan, and then they look at the peripheral areas or the surrounding area of your ovaries to make sure there are no, these cysts are not there. We are going to have a gynecologist one time to come and talk about polycystic ovarian syndrome. The other cause that is biological that could be responsible for infertility in women is premature ovulation incidence. When the ovaries stop working normally before the age of 40. Sometimes, due to some conditions, the ovaries stop producing these eggs below the age of 40. There are so many health conditions that could be responsible for that. The other biological reason could be thyroid disorders. You see, when someone has a problem with their thyroid, the thyroid releases hormones that are responsible for most of the production of other reproductive hormones from the pituitary gland. So normally when the thyroid is over-functioning or under-function, which we call underactive or overactive, there is going to be disruption of the production of reproductive hormones, and eventually this is going to affect the process of ovulation. So all the above three factors that we've talked about, that is ovulation disorders, polycystic ovary syndrome, premature ovarian insufficient, and thyroid disorders, are most likely going to disrupt the process of ovulation, and eventually this is going to lead to a problem with ovulation, and the end result is going to be a failure for that lady to conceive, or for that lady to release mature eggs that are going to be fertilized with the man's sperm, eventually leading to infertility cases in that woman. So number one cause of infertility in women is if the ovulation process of a lady is affected. And we say this is normally due to hormone imbalance. So anything that is going to cause that hormone imbalance is going to lead to infertility. Number two, the second cause of infertility could be fallopian tube damage or blockage. Now, we said that when the eggs are released from their factory, this assume my hands, assume the eggs are like this. This is the normal uterus. It appears like this. So this is the ovary where the eggs are made. Now, where they are made, they move through tubes to enter the uterus. Now, on those tubes, there is a place called oviduct, or there is the tubes are called oviducts or fallopian tubes. Now, in those tubes is where fertilization is, where this egg that has been released from the ovary is supposed to meet a man's sperm for fertilization to take place. And if fertilization takes place outside the tubes, then we are going to have what we call ectopic pregnancy. That is a pregnancy that is not going to be found in the right place inside the uterus. Okay? So, when the fallopian tubes are blocked or are damaged, this is going to prevent the ovum from meeting the sperm, and eventually fertilization cannot take place. Now, so many factors can be responsible for this blockage of fallopian tubes of damage. Number one, we have what we call pelvic inflammatory diseases or PID. Number two, we could have sexually transmitted infections. Number three, they could be due to previous surgeries. For example, you had maybe ectopic pregnancy, and as they were removing it, some damage happened to this fallopian tube. Now, any problem or anything that affects these tubes eventually is going to affect fertility of that lady, because there is no way, natural way, the egg is going to meet the sperm. Okay? Sometimes infections occur to these tubes and cause conditions like I said earlier, hydrosalpinx. That is where there is fluid accumulation. That is where there is fluid accumulation in these tubes. Sometimes there is pus develops into those tubes, which we call pyosalpingitis. Sometimes the tubes become inflamed, which called hydrosalpingitis. Now, all these are going to stop the woman's egg from meeting the man's egg to cause fertilization, and so that lady can also cause infertility in that couple. And this time the cause is because of the lady suffering from certain diseases, but also the surgery. So the other factor that could also be, but the other biological factor that could be responsible for infertility could be uterine or cervical problem. Now, the uterus in Uganda is called Nabana. That is the place where the baby is supposed to grow from. The uterus houses the growing gestation sac that is going to contain the baby. Now, if there is any structural abnormality to this uterus, most of the time it is going to affect the process of implantation or even the sperm movement. Because when you sleep with a man and the man releases his sperm, the sperm is going to get out of the man's penis through the penile urethra and enters the woman's reproductive system through the cervix. Now, if there is a problem, a structural problem with the cervix, if the mumwagwanabana has a problem, or if the cervix has a problem, then the sperm released by the man is not going to be able to reach the fallopian tubes. Okay? The sperm, because the normal process is that when the sperm goes through the cervix, it's going to go through the endometrium, that is the inner layer of a woman's cervix, and then enters the fallopian tubes or the oviduct, which we talked about earlier, where it is going to meet the ovum or the egg of a woman, and then fertilization is going to take place. Now, if there is a structural problem within that root, that is the uterus or the cervix, then fertilization cannot take place naturally. Okay, now some of the structural problems that we can have may include fibroids. Sometimes if a woman has very big fibroids, they may not be in, those fibroids may block that egg from, the sperm from reaching the fallopian tube where fertilization is going to take place. But also, after fertilization has taken place, those big fibroids sometimes may prevent implantation, because after fertilization has occurred, that formed zygote is supposed to come and attach on the walls, the inner walls of the uterus, on the endometrium layer. Now, if there are big masses that are bulging inside into the endometrium, sometimes they may affect that process of implantation. So if the baby cannot attach itself within given hours after fertilization has taken place, then the baby is going to move out in a process which we call miscarriage or missed abortion or things like that. So it is really very important that we examine a woman's uterus to rule out any form of abnormality that could be responsible for that could be responsible for these infertility cases. Okay. Again, if you're here for the very first time, we ask you to subscribe and make this your home channel. We are here every Sunday morning to talk about different healthcare conditions, and today we are talking about infertility in women, and we are discussing the most probable causes. So we've talked about infertility disorders. We've talked about, now we are talking about uterine or cervical problems. So sometimes there is also a condition where the cervix produces thick mucus, and this mucus becomes thick that the sperms cannot go through, or the sperms cannot move through to enter the uterus and eventually got the fallopian tubes where fertilization is supposed to have. So any problem that affects the uterus or the cervix is going to affect the movement of, number one, the movement of the sperm, but also number two, implantation of the fertilized egg on the walls of the uterus, eventually causing infertility issues. Okay, so the other condition that we may look at that could be responsible for infertility is endometriosis. Okay, endometriosis is where the inner layer of the uterus, which we call endometrium, is located in another part of the woman or in the other part of the uterus that is not the endometrium. The endometrium is responsible for the menstruation period in a woman. But if that layer or that tissue accidentally grows in any other part of the uterus, the woman is going to bleed at 2 points. You're going to bleed from the normal endometrium that is supposed to bleed, but also that layer, wherever it is located, it is going to bleed, or it's going to experience the so-called periods each time you receive your period. Now, sometimes this blood that is coming from this ectopic endometrial tissue is going to cause enlargement of the uterus. And this enlargement of the uterus sometimes is going to block or is going to compress the fallopian tubes, eventually causing a blockage in these tubes, and then causing, preventing the ovum from meeting the sperm for fertilization to take place. The other issue that is responsible, issue number 5, that could be responsible for infertility among women is age-related decline. A woman's fertility normally declines after age of 35. So after 35 years, the quality of a woman's egg will start to reduce. And modern science is giving us so many diseases that could be responsible or could be in children produced by women above the age of 35. So normally when a woman is 35 years and above, the quality of their eggs, especially the DNA in those eggs, starts to deteriorate. And this could also affect, this could also cause infertility in women. So it is always advised that a woman gives birth to children as early as possible. The other issue that we could look at is hormone imbalance. Hormone imbalance normally due to the menstrual cycle, and like I said earlier, if there is anything that disturbs this normal balance of hormones in a woman, especially the estrogen and progesterone, that woman may have challenges or difficult conceiving, because all the process involved in reproduction have a hormone that actually triggers them, or a hormone that controls them. Now, when those hormones are affected, sometimes you're going to have challenges. And so many things can cause this hormone imbalance. Sometimes the foods we eat, sometimes the drugs we take, sometimes you've used the contraceptives before, or family planning pills or injectables. But even when you stop them, the hormone from those drugs or foods or whatever you are using continue to give the effect of hormone imbalance, and eventually delaying or stopping you from conceiving or having a baby. And then number 7, lifestyle. Lifestyle and environment factors, things like smoking, excessive alcohol, drugs, poor diet, obesity, extreme weight loss, extreme weight loss, which could be caused by over-exercising, chronic stress and poor sleep, are other things that eventually can affect you. Eventually, all these sometimes are going to affect your hormones, and then that is going to go back to what we explained later. Okay, so the other question that I was asked here is how does lifestyle, age, and health condition affect fertility? I'll start with age and fertility. Like I've said, fertility is normal at a peak in the early 20s. When you're 20 to 30 years, that's the peak for you to be fertile. The eggs are produced in, like your eggs are produced well, and then the DNA is, the eggs are good quality. But then after the age of 35, you start to experience a decrease or a decline in the quality of the eggs that are produced by your ovary. So any woman after 35 years, the quality of the eggs that you release start to decline. And so your chances of becoming pregnant start to reduce. And at the age of 40, the chances of actually natural conception significantly become lower. And also, after the age of 40, the chances of miscarriage actually increase. Okay, so it is really very important that women plan their time so well, such that in the early, between 20 and 30 years, you have all the children you want to have, and after that age, you plan to stop, because like we've said, after 35 years, the quality of your eggs start to decline. And also your chances of miscarriage also increase, especially after the age of 45. And then science also continues to tell us that the reason actually the quality of your eggs start to decline after 35 or 40 years of 40 years of age is that after 35 years, it is easy for your DNA actually to start getting destroyed, for your egg DNA to start getting destroyed. And so you may have children that have issues to do with DNA related health conditions or disorders. So if you're already watching this and you have a husband, but due to some reason or the other, you're not sure if you should have children or not, remember that for you, you have a biological clock. Beyond a certain age, you may not be, or it may be hard for you to conceive children naturally. The other issue that we can look at is lifestyle factors. Things like obesity. I've talked about smoking and alcohol. These can damage the eggs. They can also reduce the ovarian functioning, but they can also affect your hormone balance in the body, eventually leading to infertility. The other factor that we can also talk of is unhealthy diet. When you eat highly processed foods, most likely you're risking your body to diabetes, whose effects again may affect the hormones in the body that may affect ovulation and eventually leading to infertility. But also, as we talk about weight, underweight or extreme underweight and extreme exercise, women who want to reduce your weight so much and then you reduce your body mass and then you become too small, sometime if you overdo it, this too is going to affect your ovulation. And if you've been critical, people that have been athletic, women that have been too athletic for so many years, when their time to conceive comes, normally they have issues to conceive naturally. This is simply because too much exercise or underweight or extreme underweight sometimes is going to have a significant effect on your ovulation. The other factors are stress, poor sleep, environmental toxins, and other things can also lead to infertility. General health conditions, certain medical issues can directly also cause infertility. Again, polycystic diseases like polycystic ovary syndrome, I've discussed it. I say this is where your ovaries have very small cysts around it. These prevent the eggs from reaching maturity, but also it prevents ovulation from occurring, eventually stopping fertilization and eventually making you to become to suffer from infertility. Number 3, or the other factor could be thyroid disorders. I've said the thyroid is responsible for the production of hormones that are responsible for your ovulation and other reproductive function. Diabetes and insulin resistance, endometriosis and fibroids, then STI, sexually transmitted diseases, can all, if left untreated, can all affect your ovulation or can all cause infertility. So those are some of the causes of infertility. So the other top area that I want to discuss is what are some of the solutions that are available if a woman or if a lady is infertile, or if a lady is having issues with infertility. What are some of the available solutions? So if you're out there and you're having issues with, you're having fertility issues and you're a lady, you should not lose hope. You have so many options available to help you have a child of your own. Number 1, when it comes to looking for solutions for fertility in women, we normally consider what the cause is. Most of us, the ladies, we fail to have children because we failed to go to fertility clinics to find out the cause. Now, the solutions of fertility in both men and women start with us identifying the probable cause of the problem. Stop pointing fingers You're not having children as a couple, and then you start saying, oh, but I experienced my period so well. Then the problem is not with me. Maybe it is with my man. Like I've explained earlier, that when that there are so many factors that could be responsible for your infertility. Some of them could be due to ovulation. Some of them could be due to structural problems on your uterus or cervix. Some of them could be on hormone levels and other things. So the moment you're married for more than 1 year, you're having sex on regular intercourse, you're not on contraceptives. If you're not having children, number one, go and seek medical attention. Go to qualified healthcare professionals and they try to find out a cause. Again, to the men watching this show today, let us support or let us escort our women when they are going for these investigations. Why? When the two of you check together, it is easy for the practitioners to do tests or to do examination to find who is responsible. Because like I said when I was starting, that 35% of infertility cases in couples is due to men and 35 is due to women. So that means both of you should move together. The biggest problem or challenge why some couples delay actually take so long before they have their first breakthrough when they experience infertility issues is simply because each of them moves alone. When your wife is not conceiving, instead of taking her to hospital or both of you going, you decide to start sleep around. You check around. You sample somewhere else. Now, when you sample that, those people sometimes become pregnant. And the poor you, sometimes you think the child is yours, not knowing that maybe the person you slept with also slept with another person just to make you happy. Okay? So the same thing with women. You're not conceiving, you think the problem is with your husband, you start to move around, to cheat around. Before you know it, you're contradicting other sexually transmitted diseases or infections. Okay, so if you've been together for more than 12 months and you're not having a baby, the two of you should visit your primary health care provider, discuss with them, and then you're going to find a solution together. The simplest thing is to check a man for their sperms, and they do a sperm analysis. If their sperm is okay, then they can go on the side of the lady. The simplest exam is an ultrasound scan, where they are going to look at the structure build-up of your organ. They are going to look at your cervix. They are going to look at your uterus. They are going to look at your endometrial layer. They are going to look at, they are going to screen and see if there are no masses, fibroids, or ovarian masses. They are going to look at your ovaries. So if everything is fine, then they are going to look at, to do a blood analysis to look at your hormones, to look at the hormone levels. If your hormone levels are fine and then still they are not seeing a problem, then they may go in to look at your fallopian tube, and here they may do investigation like HSG, hysterosalpingograph, where they inject some dye through your vaginal canal that moves retrospectively or backwards to exactly mark out your tubes. And then if the tubes are okay, then they are going to tell you everything is fine. Sometimes they do an ultrasound scan and the uterus is fine, your ovaries are fine, your tubes are fine, but then maybe you have a problem with your brain or the pituitary gland that is responsible for release of those hormones. Okay? So if they do a hormone study and they realize there is a problem, the doctors are going to find out what could be the probable cause of the problem. And like I said, the solution to infertility in women majorly is going to depend on the probable cause. So stop going to herbalists, abasawo b'ekinnansi, and those women that keep selling you medicine in jerry cans, that they are treating your infertility, and yet they have even not checked to see the actual cause. Sometimes I feel we are too easy to manipulate. How would you go to a woman that has not even done your scan, that has not even done your blood analysis for hormone levels, and they start to give you drugs to help you with issues of infertility. They even don't know if the problem is you or your husband. They don't know if you're having endometriosis, if you're having fibroids, if you're having polycystic ovarian disease, but they are giving you medicine in drugs to take. I think those are people that are manipulating you, and they are not going to help you. Because like we've explained earlier, there could be 20 plus causes of infertility in women. So how do you allow someone, a herbalist or a woman that has not even done any investigation on you, to give you drugs to handle infertility? So, like I said, every family deserves a chance to have a child of their own. But the longer you take as a lady to find out the actual cause of this infertility, the more you're losing your chances of having a baby of your own. Because I say that at the age of 35, the quality of eggs produced by your ovary starts to deteriorate. So some of the probable solutions to women that are having infertility: number one, there could be medical treatment for hormones and ovulation problem. For example, if we do your thorough checkup and we realize that the reason you're having infertility issues is because of ovulation problem, or you're not ovulating well, we are going to use medical treatment to help you improve your ovulation cycle or process. So we have sometimes drugs we call ovulation inducing drugs. Those are drugs that they are going to, that are given to women to induce ovulation. Women who have maybe having issues with the ovulation cycle, who are not ovulating well, they are going to give you those drugs to induce your ovulation. And this is normally women who are having polycystic ovarian syndrome, especially if it's on one side and not both sides. They are going to give you drugs to actually reduce that cycle. And when that cycle comes, remember I said ovulation is that period where the egg grows to maturity and then it is released by your ovary into the tubes where it is supposed to be fertilized by man's sperm. And here the success rate is high. We have so many women that are suffering from polycystic ovarian syndrome, then they give them these drugs and eventually have a normal ovulation cycle. And on the first try, they are able to conceive. The second option for women with infertility issues is surgical treatments. Now, remember we said that the second biggest cause, now the causes, if the causes is ovulation, we give drugs that induce ovulation to occur. But remember the second problem we talked about was the structure of the uterus or cervix. Sometimes the causes of infertility is because you have a fibroid, is because you're having endometriosis, is because you're having a cervix that has structural issues. For example, I've scanned somewhere within my 12-year practice, I've worked on a patient who didn't have a cervix. So each time they ovulated, blood would get stuck inside. Okay, so if you're having structure with a cervix, some people have two cervix. Some people have a septate uterus. Your uterus is septated into two. Some people have a uniconnuate uterus. Some people have a diaphylis uterus. So those structural difference, if we do a scan and we discover that the reason you're not conceiving is because there is a structural difference, or there is a structural problem with your uterus, your tubes, or your ovaries or your cervix, then we are going to go in for surgical procedure and try to correct whatever is not appearing well. So problems like blocked tubes, fibroids, endometriosis, in these cases, surgery can actually help. So sometimes there are scars on the endometrium. You've had maybe multiple abortion or miscarriages, so you start to experience, you're starting to experience the scars. We are going to go in, do a laparoscopy or a stethoscope and remove those scars to allow implantation to occur or to allow fertilization to occur or to take place naturally in the fallopian tubes. And here we've had a lot of success stories. So, but if we cannot solve your problem using hormone-inducing therapies or surgical alternatives, or if we believe that naturally your eggs have a problem, they cannot, maybe they cannot move, they are manufactured, your ovary makes the eggs, but due to some chronic illnesses or your fallopian tubes are totally damaged, we can now go into what we call assisted reproductive technologies, ART or ART. So this is now where we have things like intrauterine insemination, where we pick a sperm, a man's sperm, and insert it directly into the uteruses, into the woman's uterus during ovulation to improve the chances of fertilization. Okay, especially if the cause of infertility is not known. For example, if you have a normal ovary, the man has normal sperms, but for some reason you cannot produce. So what we do that intrauterine insemination. They are going to pick a man's sperm and put it directly into your uterus or close to the fallopian tubes, and then for ovulation to occur. Then we also have what we call in vitro fertilization or IVF. In this case, eggs are removed from the ovaries. We take them to the lab. We fertilize them with your husband's sperm to form the embryo. And then when the embryo is formed, the best embryo is taken and inserted into the woman's uterus. And this is actually one of the most effective or most used way in cases of blockage, bilateral blockage of a woman's fallopian tubes. If a woman's tubes are blocked completely and there is no chance of the eggs moving from the ovary to come to the fallopian tubes for fertilization, or if they are blocked that the man's sperm cannot meet the woman's ova, this is what we are going to do. IVF. I think most of you have heard about IVF or in vitro fertilization. They get your eggs from the ovary, they get a man's sperm, they go to the lab, they fertilize them, and a lot of fertilization is going to occur. And so depending on the number of children you want to have, if you want to have one, they're going to pick up one embryo and now put it in the woman's uterus, and then you're going to have a baby. But also this is good, or this is important when a man has poor quality sperms. Okay, so that is that. So the success rate is about 30 to 60%. Sometimes also they do this IVF and they fail depending on some factors, but at least the success rate is up to 60%. Now, there are also conditions when a woman cannot have eggs anymore. Your ovaries have a problem. For example, you find yourself that maybe you're past age, you're old, and that's the time you've gotten a sweetheart or you want to have a child. So you're going to go for what we call egg donation or a surrogacy. Okay, so this is common for women that have low egg reserve or ovarian failure. So what is going to happen in this case? They are going to look for an egg donor. We are going to get a woman from some part of the world who is willing to donate her eggs. She's going to donate her egg, and the egg is going to be fertilized. And then two things: if it can be fertilized and put into your uterus, that is good. But sometimes if you're too old to even carry a baby, this is going to be put into another woman, and then that woman is able to carry that pregnancy to term. In some cases, you're too old, so they may be to carry a baby or to have natural fertilization, so they are going to pick some of your your ovary if they are there, some of your eggs if they are there, fertilize them, and then you give them to another woman to carry. The success stories for women that have been previously been diagnosed with infertility cases or infertility issues actually up like 60%. Today, many women are able to have children of their own. And the last option, of course, is adoption. If you've tried everything, because even with these artificial fertilization methods that we've described above, sometimes you may fail to have a child. So when everything fails, the last option is adoption. Go to any baby's home, pick a child of your choice, of your gender, and then carry into your home so that you have a baby around you. So the solutions to infertility in women today does not involve science alone, but also it involves being compassionate about other women. For example, if you're approached to donate your egg to another woman in some part of the world that you don't know, who has totally failed to have mature eggs of her own, or to produce eggs due to some health condition or whatever, be compassionate enough and donate that egg to help another woman in some part of the world also share the joy of having a child. Lastly, we shall talk about social support. Now, women failing to have children of their own, or failing to have children at a time when everyone expects them to have a child, can be draining, can be stressing, can be depressing. So if you know that person within your family that is suffering from that, or that is undergoing through those conditions, we need to be merciful enough, we need to be kind enough, we need to be polite, and we need to be understanding. We need to support them. Don't talk about them. Don't remind them how they are aging, how they are not conceiving. This is very painful. Let us be sensitive to all married women that we know are married, but for some reason or the other, we are not seeing them having babies. Sometimes the statements that you say to them break them down. Where I come from in Africa, having a child, your first child almost doesn't belong to you. It belongs to your parents. So everyone is asking for a grandchild and telling them that you cannot have one can be depressing, can be challenging to both the couple, but also to the people around them. So let's be sensitive while we are offering advice, while we are talking to the couple that is trying to have a child of their own, or talking to a couple that has failed to have a child of their own. Because what you say can either make them or break them. To the husband, if you're having a woman that has been diagnosed with a condition that affects her fertility, or that prevents them from having children naturally, let us try to be understanding and patient with them. Because the more we stress them, the more even we make their reproductive hormones unstable. So let's try to be understanding. Let's not pressurize them. Let us give it time. Let us pray to God. Let us ask God. Because we said for 15% of couples failing to have a child, the cause is not known. When they go for medical examination, everything is okay. The man is fine, the woman is fine. Everything is okay. But for some reason, they cannot conceive. So, fertility in women can be challenging, can be hard, can be something challenging to understand and to accept. That's why we've seen these women trying almost up to age of 60, trying to have a child of their own, because they keep having that hope that maybe one time a miracle is going to happen. So when we are discussing issues of infertility in women, we need to be sensitive, we need to be passionate, we need to have to ask God for discernment and the spirit of understanding, such that we don't use words that will break down this couple. Again, this service, especially the artificial therapies or alternatives, are very expensive. So if you could support this couple financially, please do. Some of these processes go for up to 10,000 US dollars. And mind you, this is trying. You could pay the 10,000 US dollars and even the process is not successful. So let's be nice, let us be human enough and understand it's not their problem. Sometimes some of them are born like that. Some women are born with polycystic ovarian syndrome. It's not their making. It's not that they were careless somewhere to have these health conditions, but they were born like that. Some women are born with endometriosis. Some of them are born with the structural issues on their cervix or structural issues with their fallopian tubes. It is not their own making. It's not that they did anything wrong. So we need to be understanding, we need to be passionate and compassionate about them. Offer support, offer spiritual support, financial support, moral support, and encourage them. Do not stress them. Do not say words that they will never forget even when they have children. Okay? Lastly, if you're experiencing this problem, I kindly ask you to go see a fertility doctor or a gynecologist. Go through your stories, do the necessary investigation to at least find out the cause. Because some people will say the process are very expensive. Okay, you find out the cause such that at least that settles down with you. Because they will tell you that the cause of this is this. But it's so painful and challenging if you don't have a child, if you think you have fertility issues, but even you don't know the actual causes. When I was starting, I started by saying that the causes can be so many. It could be hormonal, could be on ovulation, could be structural damages or issues with the uterus or cervix. It could also be with other medical conditions. So you can find out the actual cause. After knowing the actual cause, then you can plan for treatment. My call to the government of Uganda and everyone concerned is, let's try to put up more fertility clinics in all regional hospitals to give a chance to these parents that have failed so far to have a child of their own to have some tangible solutions to this problem. Because as we speak, most of the fertility clinics are either in Kampala or Mbarara. I don't know if other regions have such clinics. So my plea is that let us allocate more money to this sector of health to give a chance to every Ugandan or every woman to have a child of her own. Remember, the journey to having a child of your own starts with your will or with your choice of trying to find out what is actually stopping you from having that child. When that puzzle is cracked, when that answer is found, finding a solution, a medical solution, becomes simpler. Some of you are not having babies because of very, very, very simple things like chronic infection. Finds to places of worship to have intervention. I believe in prayer, and today is a Sunday, but I'm telling you, most of the time, it is hard for these herbalists, for these religious people to solve a problem that they don't know. Some of them are going to give you holy rice, holy water, herbal juices or concoctions to take, but the reality is they even don't know what is causing your infertility, because every case is different when it comes to infertility. So, as I conclude, this is Mr. Self-Care. I kindly ask you to go to proper medical, rightful places, fertility places. Go see your gynecologist, go see your fertility doctor to have a proper discussion about this. And trust me, you're going to have a tangible solution. Again, I want to thank you for watching. I want to thank you for being here with us. We are supposed to have Dr. Pochibenge today with us, but he's going to be with us on Wednesday. And so you can check in on Thursday. We are going to have a discussion with him Thursday morning about literally the same topic, and then he's going to give his insight, and as an expert, he's going to add more information to what I've literally discussed today. Remember, to every lady going through this challenge, or to every couple that are experiencing this challenge, you have a chance, and one time you're going to have a child in your house that is going to be a source of happiness, a source of excitement, and a source of joy. Remember, children are a blessing from God. So even if that blessing has not yet come to your house, let's continue believing and praying that one time you have a child of your own. I thank you for watching. I kindly ask you to subscribe and share this presentation with any woman or any couple that is struggling to have a child, or any couple that you know are married, but for some reason or the other, you think they may be having difficult conceiving. These are difficult conversations that so many people don't want so many times to open up with other people to discuss what's happening with them because they fear to be judged. Remember, it could be your husband, it could be you, or both of you could be absolutely fine, but for some reason or the other, you're not conceiving. Continue believing in God, continue praying, but above all, go see your fertility doctor to make sure you know the examining cause of your fertility issues, then a probable solution will be fine. Whatever you choose to do from now, I remain Mr. Selfcare, and thank you so much for watching. May God bless you. Have yourself a blessed Sunday. Bye.